Hi everyone. In this video we're going to be demonstrating how to perform a simple interrupted suture. For this reason or for this procedure you should have an idea about the non-touch technique and good handling of the instruments. Good handling of the instruments will help you to perform the procedure securely and safely without introducing any damage to the structures nearby or the tissue itself. Plus, you will not get tired soon and you will perform for a longer time if the case or the surgery prolonged for a longer time. For this reason, there are basic instruments which are used for simple interrupted suture. Basic instruments include needle driver or the needle holder, pickup or the pins, scissors. You should have a good information about how to handle ringed instruments. These are called ringed instruments. First, needle holder. Needle holder should be held like this one. Ring finger for the ring, middle finger supportive, index finger the drive or the director, thumb is for the action. You should be able to do locking and unlocking of needle holder as far as it has locking mechanism. This locking mechanism helps the needle to be secured between the jaws of it. For this reason, you should know it is not the matter of force, it is the matter of direction of the force. For closure of needle holder or for locking the needle holder is to do it this way, meaning that you lock it this way. To unlock the needle holder, you should do this maneuver, meaning that your fingers, tip of your fingers toward the palm, while the thumb presses away from the palm. So you can do it like this way, as easy as this. It's not the matter to apply too much force on the blades or the limbs of the ringed instruments. This is one. Pickup. Pickup should be held in dominant hand while you are not using the other hand, the non-dominant hand. But when you use dominant instrument like needle holder, you should hold it on a non-dominant hand, in your non-dominant hand. The proper way to handle the pickup is to notice that there is a stripped area on the blades or the limbs. So your thumb goes in the middle exactly of this one. And it sits on the other fingers. While the index is the driver or the drive or for precise movement. There are a lot of ways to handle the pickup, which all of them are true and right. But this one helps you to perform for a longer time as far as we are using many fingers instead of using 2 fingers only, or this way 2 fingers only, and you will get tired soon. Scissors, also ringed finger, the same principle, ring for the ring, supportive, drive, action. But you should be careful while you are using sharp instruments in the field. For example, scissors are regarded as sharp instruments. For this reason, if you want to cut anything in the field, you should close the tips of the blades, go to that area you want to perform the action, open as little as possible, cut, close, get out of the field. And now let's talk about the suture material. It is important to know the types of the suture material, size of the needle, shape of the needle, and other issues which are all included on the envelope of the suture material. But in this session we will talk about the handling of the suture material and to mount the needle on the needle holder and then performing the suture. For this reason, it is important to know that the non-touch technique is also applicable for this suture material. You shouldn't touch the inside. As far as the field is sterile, you should keep the suture material sterile. So you will peel the envelope of it like this way, without touching the inside, and your fingers should be grabbing the other outer surface of the suture material till you will open nearly half of it or more. Then you will drop it on the field, and you will drop this non-sterile. So this is regarded as sterile. Well, I am washed hand and scrubbed, so I will be able to touch this suture material. And then there is another pouch which helps you if you accidentally drop the suture material down out of the field. You can use this sterile pouch again, and you will do it this way. Okay. If the suture material is of good quality, the first thing to see is the needle. That's because you need to mount the needle to the needle holder without touching the needle, unless you are obliged to do it and correct the position of it. Why? The position, a good position for the needle to be mounted is 1/3 behind and 2/3 in front, or a little more if the needle is small. So proper handling, and you see, if you notice, my pinky is free, my little finger is free. It is used to grab this part of the suture material while you are extracting it from the pouch. So this will help your hand to be kept in the field while you withdraw the thread from the pouch. So let us do the simple interrupted suture. The good handling of the instrument, like this way. So imagine this is the incision and this is the wound that you want to perform this simple interrupted suture. There's a rule which is called X. X means the thickness of the skin is regarded as X. So your distance from the edge to the prick of the needle should be X. The distance between one suture and the other should be 2X. So let's do this. And the best way to perform this one is to do it separate edges, as far as you should know the underneath of it or any structures nearby. And the way to do it easily and comfortably is to rotate your wrist to make the needle insert into the skin vertically. It will be much easier for the needle to pierce the skin. So you will rotate your hand and you will see that you reach the other side of the edge of the skin. And you will grab it this way, not the tip, to prevent that needle to be slipped away. And you will off the right hand that you are holding the needle holder, and you will extract the needle with some threads, few centimeters, and you will mount it again properly to be ready for the next step. And remember to use your little finger to prevent the thread to go out of the field. You will reach this point and you will do the other side of the edge of the wound, and you will go from inside to outside and rotate your wrist again. Grab the tip or near the tip of the other side, out from the edge, grab it again. It's not necessary to be grabbed properly because you will drop this, and you will put the thread like this way. The needle should be out of your hand, and you will grab it by two little finger and ring finger and catch the other end of the thread while you are doing looping around your index and middle finger till you reach this position. To note the suture material, there are two general ways to do it. Instrument tie, which is done by the help of the instrument, needle holder namely, or hand knot. Instrument tie or knotting depend on the type of the suture material. This suture material is called silk. Silk is very soft and thin, so you can knot only 3 knots. you can do this procedure by ending it up with 3 knots, but there must be one opposite direction. Opposite direction, I will teach you how to know this. The first direction is from up down, making loop, catching the tip by the tip, not this way, not this way, tip by the tip, and move this one. Edge is just approximated, and the knot in one side, while you are returning above the needle holder. This is called the opposite direction. Make a loop, tip to tip, and move this one. And again, you will do the same direction as the first one. For more security, you can do another opposite direction of the thread. At the end of the node, you will be able to catch both ends of the thread, and you will ask your assistant, or you will do it by yourself, to cut the additional thread by doing this procedure 1 centimeter, leaving 1 centimeter from the node, and cut it, go out. And that's the simplest interrupted suture. For the sake of removal, it is very easy to do it. You will grab the pickup properly, and you will grab the node while you are able to see the thread, and cut it and pull it out. Hope you learned something from this video, and for more video, subscribe the channel.